Hello and welcome to the IdeaCast interview series, episode number 55. And my guest in this episode is Sarah Pai. And Sarah is a clinical pharmacist and a holistic nutritionist. And I asked her to come on the show, or I invited her to this show to talk about Hashimoto's and autoimmune disease. It's something that I was diagnosed with a few years ago, so yes, I have a selfish motivation for doing it. But I know that autoimmune conditions affect a significant number of us, at least in the Western world. And so I wanted to work with someone who is familiar with Hashimoto's. And but we talk about autoimmune sort of in general. We pull the lens back out. So I hope this conversation is important, meaningful, or a point of discovery for you with regard to Hashimoto. So it's not one of my typical conversations that deal more with psychology or philosophy of mind or the arts. This one zeroes in on something specific, but hopefully it'll help people with thyroid disease. So enjoy, and thank you as always to any of my subscribers. I appreciate your participation in the series. And I'd like to welcome Sarah Pai to the IdeaCast interview series. I'm looking forward to a conversation that'll be a little bit different than what I normally have on IdeaCast, which we work with the emotions or the psyche or things like this. But I found this conversation potential to be of equal importance or relevance because our physiology and our well-being physically strongly correlates to the psyche and to the emotions and to feelings. So to the YouTube subscribers that typically watch my interviews, that's what's on for today, and hopefully this video will just have a life of its own where people working with some of the medical conditions will discover it and get some really good information. So enough of me chattering. I'd like to welcome Sarah to the IdeaCast. I'm so glad to have you on as a guest today.
Hi, thanks for having me.
Yes, absolutely. I'm glad to have you. And I say that with a little bit of selfishness in the background because we both are working with Hashimoto's in our lives. And I'm a rare male Hashimoto's presenter or
Right.
host or whatever you want to call it. And so, which I guess that makes me unique, at least something I can stand out from the crowd, you know. But I didn't take time. I meant to do this. I meant to look at the statistics. Do you know what it is, male to female ratio?
It actually is much more common in females, you're right.
Okay.
For hypothyroidism, it affects approximately 1 in 5 females, so about 20%.
Okay.
And then males, it's a little bit less than that. It's about 1 in 10, so 10%
Oh,
of
okay.
males affected by hypothyroidism. And then the percentage of those people who actually have Hashimoto's, it's estimated about 90% of people with hypothyroidism have Hashimoto's.
Okay. Okay. And so again, to the YouTube audience, you're getting a preview of what we're going to be talking about, i.e. Hashimoto's. But I would like to ask Sarah to go ahead and give us a little bit of a career bio background story and give us some insight into what brought you to where you are today, because I think knowing a little about your background and what you currently do for a living and your training and education will lend itself to the totality of this conversation. So if you just let us know a little bit about your history.
Yeah, of course. So I'm a pharmacist. I've worked in, I guess if you want to call it the conventional medical system for well over a decade now. And I really enjoy my work as a pharmacist. I certainly do. A couple years into my practice, though, as a pharmacist, I began noticing something that I could just no longer ignore. And what I began to notice was that my patients were on a lot of medications, but they weren't necessarily always better. Um, I'm a clinical pharmacist, so I have specialty training to work in the hospital setting. So I work directly on the wards with the patients, with the doctors and the nurses and other members of the healthcare team. And so I do work quite closely with the patients, and it could be very, very common to see a patient on 10, 20, sometimes even 30 medications or more could be very, very common. But as as I'm talking to my patients and I'm reviewing their medications, I'm realizing these patients are still struggling oftentimes with their medical issues. So we think, okay, we have an issue, we have a condition, we'll provide the treatment in a form of the drug and the patient should be better. That wasn't necessarily always the case that I was seeing. And actually, I would have patients asking me, they would say, what else can I do? Right. And my answer at that time, of course, was thinking of, okay, what drug are we missing? Like what next drug can we add, and over time, this approach wasn't fully sitting right with me. And part of it had to do with my own health journey I had been on thus far. I kind of struggled for most of my life with an array of symptoms, everything ranging from digestive issues to skin issues to joint pain and just general inflammation that I never had an answer for, even despite becoming a pharmacist. I was aware of every single drug treatment available, and I still didn't have a solution to some of my own health issues. And this kind of just all got me thinking of, what are we missing? Like, what's the missing piece here, right? Actually, a couple years into my career, my fiance at the time and we kind of had, I guess you could call it maybe a quarter life crisis. We had both finished our schooling. We had started our careers. We'd been, working our 9-to-5 jobs. We checked all those boxes. And we kind of were like wondering, is this it for life, right? Like, is this it? Like, this seemed kind of anticlimactic. We worked so hard to get where we were, and then was this it? And so we'd actually taken a year off work to travel. We just decided, you know what? Let's just quit work for a year and just go travel. And so we did. We packed up backpacks and off we went. And this year off was really, really eye-opening for me, because I ended up in numerous different circumstances in which my eyes and my mind were open to the possibility of other forms of medicine other than what I'd known to be medicine. So one example was we were volunteering on a coffee farm in rural Nepal. And when I say rural, I'm saying like we needed to bring a bus through a very windy dirt road that only brought us part of the way. And from there, we had to hike into the village. And so we were volunteering at this coffee farm that it didn't have any electricity. It had no running water. And, we were far away really from pretty much anything. And while we were there, the owner of the farm, his name was Surya. People from the village were coming to see him, and he was performing kind of like these energetic rituals, I would say, on these people. Maybe it was some form of Reiki or there was chanting. I wasn't sure exactly what it was, but it definitely piqued my interest on, what was going on here. And I had a chance to speak with one of the women who had come to see him one day, and she didn't speak great English, but she was able to share a few words with me. And she was explaining to me that Surya was the healer in the community. And when she had a headache, she would come to see Surya, and her headache would resolve. And I just kind of, like I said, piqued some curiosity in me that, here are these people, they're miles and miles away from any kind of a pharmacy, doctor, a hospital, a clinic of any kind. They don't have easily access to pharmaceutical medications, but they're using other forms of healing modalities. And keep in mind, these, I'm not saying these people had major illnesses or injuries. We were talking about a headache in this case, but it was just kind of the first kind of insight I had into like, oh, what do other cultures around the world, what are they using for medication, right? Like, is it that there's other forms of medication other than, pharmaceutical drugs, right? So that was one experience, but really, what brought me then to nutrition, in particular, was later on in that exact same trip, we had stumbled upon a yoga and meditation retreat in Cambodia. And here at this retreat, there was a nutritionist, and she was giving some talks about the power of food and your health, like how you can use food to heal your body. And of course, the conditioning I had in my mind at that point was kind of like, what is this lady talking about? There's, food has nothing to do with your health.
Mm.
But here I was at this farm, and the only food we were eating while we were at the farm was all, very clean, nourishing diet of mostly fruits and vegetables grown there on the farm, and rice. And as this woman is talking about this connection between the food you eat and the way you feel, I'm noticing in my own body, I'm feeling the best I'd ever felt in, weeks, months, years, even. So many of these chronic symptoms I dealt with my whole entire life, it seemed like many of them were resolving as I was eating this certain way while I was here at this resort. And it just, once again, really piqued my curiosity. And I thought, interesting, like, is there something to this? And from that point on, I just began reading and researching every single thing I possibly could about the connection between food and health. And I just, started digging deeper and deeper and deeper into it until I eventually just decided, like, I'm going to apply to become a nutritionist. And I did. Before I had even returned to Canada from that trip, I had submitted my application to the Canadian School of Natural Nutrition, and I was accepted. And when I returned back to Canada, I attended school to become a holistic nutritionist. So pharmacist first, holistic nutritionist second. And through my learnings at the school, I learned exactly what the connection was between my own health issues and the food I was eating. And it was just really quite eye-opening. And from that point on, it's just really become a passion of mine to combine the two, combine the more conventional medical model where we use pharmaceuticals, surgeries, and interventions to treat everything, with the other side where we can use like food, nutrition, or other natural modalities to treat ailments and illness. So yeah, it's just become such a passion of mine to combine the two.
Yeah, and so there's a few things I could bracket in what you were saying. So I guess I'll start chronologically with what you were saying. And congratulations on doing the year off. I think that's really awesome. And people should do that before they settle into a long stretch of 15, 20 years or more of doing a career. So that was a good move. It seems intuitive, and my takeaway in what you were saying about going to some of the more rural or austere or less developed, as we like to say in the West, which is a bit arrogant, but these areas of the world, the absence of modern medicine, Western empirical techniques of evidence-based medicine and so forth, really does create novelty, and it creates means that can be garnered regionally or locally, or with a mindset that isn't, again, framed in the way that we do it, with our Western medicine. So I like that, that we can see, perhaps, again, beyond our own lens of Western medicine, to understand that they're doing something there. And like you said, they weren't curing end-stage cancer, or they weren't doing any broken bone healing with chants or anything like that, but just the day-to-day routine where, we might go to an Instamed clinic, they go to the shaman or to somebody in the village that has wisdom from other people that they apply. So that it was a good insight that, we can look with, I think, reasonably open-minded eyes or a lens to understand what people are doing around the world that don't have access to all the modern contrivances and the chemistry and so forth. And then the other thought that I had is, one of the reasons I was attracted to bringing you onto the show is that you do have a clinical background and you have an academic background that gives you some stance to see the sort of point counterpoint to make a kind of synthesis, as you said towards the end. And I like that too, that you have the wherewithal to understand how you can integrate, say, holistic medicine or integrated medicine effectively. And so, there's all kinds of people out there in the world, and I don't think you fall into that category where you're just maybe operating under cognitive bias of some kind, or where you're thinking, oh, but big pharma's bad, or the medical industry is corrupt, or anything like that. You're in there and you have your hands working with that. So I say that as just a point to those in the audience that we can have a sincere conversation about what does an integrated system look like. So now, with your specific background physiologically and medically, how did you come to find out that you had Hashimoto's, or were there other things? What's that history for you? I mean, you said that when you went on this sabbatical or this trip, that you were probably laboring. In fact, you said this, you labored with some physical conditions. And so at what point when you came back to Canada, did you get that diagnosis, or were you working around trying to figure out what was going on and getting other thoughts about what might be happening? What's the story on that?
Yeah, so my diagnosis with Hashimoto's actually did come a little bit later.
Okay.
I'd known for probably about 5 or 6 years now that I had elevated thyroid antibodies. So at one point in time along the line, I did have some blood work done just to try and sort out everything that was happening to me. Of course, I was beginning to feel some fatigue amongst some other symptoms. And interestingly, my labs had come back with elevated thyroid antibodies at the time. However, no really big deal was made of them at the time by any kind of medical practitioner. It was my thyroid levels themselves were normal, other than the elevated thyroid antibodies. It wasn't actually until after the birth of my son where I kind of developed a kind of the full-blown Hashimoto's condition. So when I first knew that my thyroid antibodies were elevated, I kind of just took that as information for myself. So I'm a true believer that knowledge is power. The more information we have about our health, the more things we can do to, kind of address those issues. And so at the time, my emphasis was very much so on reducing inflammation in my body, identifying and removing any food sensitivities that I had. Really removing as much exposure to toxins as I could. I kind of went through my entire house. I swapped out all of my, cleaning products, all my personal care products for more natural versions, and just really focused, once again, on an anti-inflammatory diet. And I think doing all of those things kind of kept the issue at bay for a number of years. It definitely allowed, those antibodies to settle and no more further destruction to happen to my thyroid. But yeah, like I said, it was after the birth of my son where things really did end up going south for me. Pregnancy and the postpartum period, there's a very, very highly demanding time on the thyroid. And there's some significant changes that happen within the immune system during pregnancy and the postpartum period. And I think just those two things combined, the thyroid just couldn't keep up anymore. And I ended up about 5 or 6 months postpartum with just absolute profound fatigue. It was so significant. It was all I could do to make it between my baby's napping times. I'd be laying on the floor with him playing, kind of looking at the clock like, when is he going for a nap so that I can go for a nap again? Just really significant brain fog. I was forgetting things. I couldn't think clearly. I couldn't string sentences together. I was losing, handfuls of hair. I couldn't get warm. Like, I just had so many of the classic symptoms of hypothyroidism. And everybody kind of kept telling me, these are just symptoms of being a new mom. Even
Mm.
my doctor told me this. She said, you're a new mom. It's normal to be tired. It's normal to lose hair. Like, this is what happens when you're a new mom. And so I actually ended up suffering for much longer than I really needed to have, because I myself began believing that too, like, okay, this is just what it's like to be a new mom, until eventually I kind of came to my senses and I thought, no, this is not normal. Like, what I'm experiencing right now, it's not normal. And I, went back to my doctor again, and I, requested more blood work, specifically the thyroid, knowing the issues I'd had with my thyroid in the past. And sure enough, my TSH came back extremely elevated, my thyroid hormone levels
Mm-hmm.
low, very, very low, and my thyroid antibodies significantly elevated as well. So at that point in time, I did receive the formal diagnosis of Hashimoto. So yeah, interestingly, I had kind of already begun my journey of exploring the natural health realm and the nutrition world before my diagnosis of Hashimoto's came in, which is kind of put me in an excellent position to kind of already know what I needed to do when the diagnosis came down the
Yeah.
line.
Yeah, for sure. Yeah, it's fortunate in your case that things lined up the way they did, and that you had that foresight to know that your antibodies were elevated, and there was a potential that you were a candidate or you might be at risk, and that yeah, I guess having a child and producing a child is a real wallop to the system, and so it kind of makes sense that would set it over the edge. And so for the YouTube audience, if you're here because of the thyroid matter, go ahead and share in the comments, if you want, your story about how you felt prior to being diagnosed, and how you were diagnosed, like what you presented to your physician, et cetera, because there might be some help to others who are experiencing symptoms. I mean, you can go to Google, obviously, but anyway, if this helps, please feel free to share in the comments. So you've had your child, you were diagnosed, and then I suspect, like a lot of us, you were given not very many options. I was doing a tiny little bit of background research, and I also noticed that certain viruses can, let's say you're a candidate, you're in that potential group. And I know I was reading certain viruses can trigger Hashimoto's to be activated. I got mine, I think, I went to a neurologist because I was having what was basically ataxia. I couldn't walk very well, and a staggered gait, not being able to function terribly well. And she thought I might have had an ischemic attack. So they threw me in an MRI, and that's when they found the enlarged thyroid. So mine came about sort of from an oblique way. So anyway, for the audience to share.
Yeah.
So when you were given the diagnosis of Hashimoto's, what were the steps following that for you as far as your care routine?
Yeah, so my doctor started me on thyroid hormone replacement, levothyroxine, which is pretty
Mm-hmm.
standard of care in the medical system, and kind of said, made no big deal of it at all. Not that I needed a big deal made of it, but was kind of like, oh, your thyroid's off. Here's the medication. See you later. In 6 weeks, we'll repeat your blood work, kind of thing. And of course, that medication was a savior for me at the time. It brought me out of a place essentially of not being able to function. Here I am
Okay.
with a new baby, barely functioning. It brought me from that place back to some level of normalcy. Um, and at the time I felt great, right? But I was feeling great relative to how bad I had just been feeling.
Mm-hmm.
So 6 weeks or so on the medication, I started feeling good again. Of course, went back to the doctor, had my labs repeated. The only lab that the doctor ordered at that point was the TSH, which is also common. It's typically the only marker that the medical system rechecks, and that was normal. And the doctor kind of said, okay, everything's good, see you in a year or so. And as I started to settle back into kind of this new normal, I realized although I was better, I was significantly better, I still wasn't, I was still.
Okay, so there was a minor glitch there, and you're back. And so
Okay.
you were in your routine. You had gone through follow up. You're on the levothyroxine, but
Right.
things were still relatively not 100%.
Right. I was better. I still wasn't great. And it's just really interesting that this kind of comes back to, what I was saying at the beginning. It's just Hashimoto's is such a great example of a condition where the way we treat it in the conventional medical system still leaves a lot of people to struggle or suffer with symptoms even when the treatment is considered adequate. And so here I was, sort of living proof of this very same phenomenon I was seeing in a lot of my patients, that I was receiving the best medical treatment I could have, but I was still quite symptomatic with the Hashimoto's. And so really for me, it was really analyzing, okay, what is the root of all of this, right? And you had kind of mentioned that a little bit earlier, because the thing with thyroid replacement therapy in Hashimoto's or hypothyroidism is that although it replaces the missing thyroid hormone, it doesn't actually impact the root cause of the condition. Like, what is the issue of the condition, right? And in Hashimoto's, we know that this is an autoimmune condition. So there's some degree of inflammation and an autoimmune process happening that the medications we use for the condition do not address. And so unless we take it on to address those issues ourselves, we're sometimes left with symptoms even being on the medication. So it was really coming back to the basics and looking at, what is at, what could be at the root of this, really focusing on how can I reduce inflammation in my system, and then how can I optimize my nutrition to support my thyroid, especially in the, pregnancy and postpartum period, which is a very nutrient depleting time. It was really focusing on all three of those things.
Okay. And now that we've moved the lens back one notch and we're talking about autoimmune conditions, prior to my knowing I had Hashimoto's, I was not feeling good. I was presenting ataxia, and which I don't know what that what the genesis of that is to this day. I still have mild it's still there in the background a little bit, but prior to getting the Hashi's diagnosis, there were a lot of things going on. And so one of the things I would do is try to help my body and boost it up. But again, as you know, with the autoimmune, that good is bad, so sometimes trying to stimulate your immune system and doing things to help you can actually make things worse. And it was at least my experience. And I think I've read anecdotally that can be a problem for others. So yeah, it's a kind of interesting phenomena to move through, and finding that balance point. So, and I'm curious because you've hit on something that I've never even really thought, I've thought about it, but I've never really dug deep to address, which is once you're on either the NP thyroid or levothyroxine, how can you gauge what normal is? So maybe I've been dealing with it for so long that I don't know what normal is anymore for me, what's baseline in terms of feeling good and feeling healthy. Now I can intuit by having a good day where I don't have brain fog or I'm not fatigued or any of the other things that might be going on, temperature regulation or any of that. So obviously diet is a huge part of that. And so let's open that up a little bit more and talk about maybe the relationship between, as you said, anti-inflammatory diet and autoimmune, and maybe things that would be even more specific to beneficial or bad for Hashimoto's in itself.
Yeah, absolutely. So I'll back it up just slightly where you were saying how do we know what's normal anymore? And yeah, like that certainly is an issue for a lot of us struggling with Hashimoto's or any autoimmune diseases. So often we've had these symptoms for so long they become our normal, right? And we sometimes don't even know what it feels like to feel good. And then also these conditions can kind of ebb and flow a bit, right? Like you said, we can have days that we feel really great. We can have days that we don't feel as great. So how do we even know what is normal? Definitely, but certainly if you're, feeling fatigued most of the time, you're waking up and you're finding it hard to kind of get going with your day. You're feeling, forgetful or just kind of foggy brain, lack of mental clarity. All of these types of symptoms, they're not actually normal symptoms, right? Even though we think of them sometimes as normal because we've been living with them for so long, they're not normal and they don't have to be normal. And so one thing that can be very helpful to do is to request that your physician order a full thyroid panel if they're willing to do that. So oftentimes all they are ordering is, like I said, is the test called TSH. So TSH is the thyroid stimulating hormone. That's the kind of messenger going from the pituitary to the thyroid saying, okay, make more thyroid hormone, right? When our thyroid's low. So usually that's the only test they're doing, and they're saying, okay, that one's normal. And then, you as a patient are left walking away saying, okay, well, everything must be normal. Maybe these symptoms I think I'm having are just in my head. So really one important thing to do is request the full thyroid panel. So the TSH as well as the T4 is our active form of thyroid hormone, and as well the the T4 is our inactive form, as well as the T3 is our active form of thyroid hormone. And that's just going to paint a much bigger picture for us to see really are all the labs normal or not.
Okay.
Oftentimes, even if the TSH has normalized, the other thyroid markers can still be off. So that can be one indicator that things certainly are not quote unquote normal for you yet, as well as getting, of course, the thyroid antibodies and seeing how highly elevated they are and if they are moving in the right direction or not. Once again, can help give you a little bit more of an objective marker of whether or not things are normal, right? Because it certainly can be hard to tell, like, is this normal or is this not? And usually if you're questioning that, probably it's not normal. Yeah. And then, so moving into diet. So, there's so much when you start to dig into the world of nutrition and diet when it comes to Hashimoto's or any autoimmune disease, really. But a lot of it comes down to the gut, actually, and supporting our gut health. So we know that something called leaky gut or intestinal permeability is present in almost all cases of autoimmune disease. And so really using food to support the gut can be incredibly important in healing from any form of autoimmune disease or Hashimoto's. And that's including things like bone broth, collagen, probiotic or fermented foods can be very, very helpful in supporting that gut health. Then otherwise with Hashimoto's, you really need to figure out what your food triggers or food sensitivities are. Very, very commonly in people with Hashimoto's, there are sensitivities to gluten is very common, dairy, soy, corn, sometimes eggs. And so it's really important to figure out which of these foods you may be sensitive to, and then eliminating them at least for a period of time to see how you feel. Gluten in particular, there has been some studies that have shown an association between gluten and elevated thyroid antibodies, and a lot of people anecdotally who have stopped eating gluten find that they do feel significantly better and their antibodies decrease when they're off the gluten. So it's definitely worthwhile a trial for anybody who has Hashimoto's to do a food elimination diet for a period of time to see if there's any foods they're reacting to, especially a period of time without gluten can be incredibly helpful just to see if that is or isn't a trigger for you. And then otherwise, it's really about optimizing our nutrients that are needed for the thyroid gland to properly function. And so some of these nutrients include vitamin D, selenium, zinc, magnesium, B vitamins, and there are others as well. And not only are these nutrients essential for proper functioning of the thyroid gland, these nutrients are also very commonly depleted in people who have Hashimoto's.
So a full review of what you're taking in, whether it's supplement or complete foods that can bring you those minerals and some of the vitamins that are necessary. And one thing I know that I believe I've read is iodine can be a problem because it does support a normal thyroid, but then we do need either iodide or iodine to some extent, as I understand it, in our diet. So there's, I suppose, a caveat in there that maybe you can unpack for us about the experimentation with supplements, and to maybe double check or consult a nutritionist or a physician about maybe contraindications with what is ostensibly a good thing. And this goes back to what I was saying earlier when I was trying to boost my immune system up, because I thought maybe it would help, and then I would feel stuff would happen, and I was like, oh yeah. So would that be the case, that you want to maybe tread lightly on some of the supplements that intuitively seem like they're there to support you?
Yeah, I mean, iodine is a very interesting one because certainly we know that iodine's required for the building of the thyroid hormone, and that iodine deficiency is a cause of hypothyroidism. However, this is the case more so in the developing world, where there truly is a deficiency of iodine. And it's much more common, however, in the Western world. We have exposure to excess amounts of iodine in some cases. And the excess iodine is actually a trigger for the inflammation or the autoimmunity in Hashimoto's. So it is opposite what we may think, is that in Hashimoto's, we actually want to be careful not to get too much iodine. So that is confusing, does confuse a lot of people. And certainly if you weren't sure, you would want to work with your doctor or functional medicine practitioner to tease out what your iodine levels are. And if that's the case for you, that you have an iodine deficiency, usually it's not. In the case of Hashimoto's, exactly, usually it actually makes things worse. Yeah. And then I will just say too, just in general, for Hashimoto's, just like I had alluded to earlier, reducing your chemical exposure or toxins in both your personal cleaning product, or your cleaning products, your personal care products, but also in your food. So important, just switching off of what we call like a standard American diet that's full of processed and refined foods, and just onto a whole foods diet. Foods that come directly from the earth, that are highly nourishing for us, things like fruits, vegetables, grains, legumes, nuts, seeds, meats, and other animal products. So really, that's the way we want to be eating, and those are the foods that are ultimately going to provide us the nourishment our thyroid needs and our immune system needs to function optimally. And then we want to be avoiding, foods that are highly inflammatory. So these are things like excess amounts of sugar, processed or refined vegetable oils can be highly inflammatory. Dairy, I had already alluded to, can be a highly inflammatory food for some people. So those are just kind of some more like basic dietary principles somebody with Hashimoto's would want to explore. And then certainly the more specific nutrient deficiencies, you may want to work with a practitioner to have some of those levels monitored to see where you're at and see if you need specific supplementation to address them.
Okay. Yeah, good advice. Good advice. So you had mentioned elimination earlier, and can we focus on for a moment what that looks like, if you have a story of your own, or what you would prescribe as a nutrition or a more holistic oriented healthcare provider, how somebody would go about eliminating foods, but nonetheless nourishing themselves and striking that balance where they're discovering what the triggers might be.
Yeah, of course. So my own story, like I had mentioned already, when I was at the retreat center in Cambodia, and naturally just being there, eating this very clean diet of basically fruits, vegetables, and rice, unintentionally I was doing an elimination diet, and that was one of the reasons why my symptoms at that time had started resolving, right? So an elimination diet does not have to be anything highly complicated. It's usually just eliminating a specific food or food groups for a short period of time. It can, 6 to 8 weeks. And, starting with some of the ones I already mentioned, the highly reactive ones like gluten, dairy, soy, corn. There can be some others as well, but those are great places to start. And then after that 6 to 8 week period, checking in with yourself, seeing how you're feeling, what are your symptoms like, and then adding those food groups back one at a time to monitor how you feel. And when I talk about food sensitivities, I'm not talking about, kind of the food allergies that, we all think of when you eat something and then you immediately have hives, or maybe even more severe, like anaphylaxis. That's something different. That's kind of mediated by a different part of the immune system than these food sensitivities that have kind of like a delayed onset of a reaction in the body. So just to differentiate, those are two different things that I'm talking about here.
Sure. And so going on what you just said, the confound would be the autoimmune condition, which again, for somebody who's normal, then eating gluten or perhaps corn or something isn't necessarily an allergen, but then you have to factor in your special status as somebody who's living with an autoimmune condition. And I've read that, and I have a friend with multiple sclerosis, that solanaceous vegetables can be pro-inflammatory. So peppers, tomatoes, things like that. So would that be something that would be on the list of things along with corn, dairy, and some of the other refined sugars and things like that?
Yeah, so for some people they can be. Yeah, I refer to them as the nightshades, the tomatoes, the peppers, potatoes, eggplant. Okay. Yeah, for some people they can be inflammatory. For some people they're not. So once again, it would just be something to tease out for yourself as an individual. But really what the issue tends to be in autoimmune disease, once again, is going back to the state of the gut health. So what is happening is these foods, these proteins, for one, people with hypothyroidism or Hashimoto's, their digestion tends to be slower or decreased because the hormone governs your digestion. So that tends to be one issue, is we're not breaking down these foods as readily. And then oftentimes in autoimmune disease, people actually have what's called intestinal permeability or leaky gut. And so these undigested food particles, specifically the proteins, are escaping into the bloodstream, and the immune system is mounting a response against them. And very commonly, that immune response then also is attacking the thyroid. So that's where kind of the whole link can come in, or at least that's what's been theorized with regards to the food sensitivities and the thyroid, specifically with regards to gluten.
Okay. Now, yeah. I'm sorry. Okay. Do you know offhand if proteolytics like digestive enzymes, like I think papaya, there's something in papaya and bromelain in pineapple, and I think there's obscure ones like nattokinase and things like that help to break those proteins down. Have you read or heard that is in any way an ally to somebody working with these matters?
Yeah, certainly somebody needing extra digestive support or can certainly benefit from some of these types of digestive enzymes, and the ones you're referring to are more like the plant-based or natural digestive enzymes can be very helpful in some circumstances. Yeah, for some people.
Okay. Yeah. And okay. And do you know if evidence-based medicine has panels or screenings that can assist in identifying agitating protein things for somebody dealing with a specific autoimmune condition, or are they not quite, is it too vague and ambiguous to be able to pinpoint something and say this particular protein, is a culprit to, or is that just way too complicated?
Yeah. I mean, there are different forms of food sensitivity testing, but nothing has been validated enough in the scientific literature yet to be able for us to draw any firm conclusions. Absolutely. Yeah. At this point in time, it's very much so individualized approach, removing the foods to see how you feel and how you react to them. The science has not quite caught up to this quite yet.
Okay. Absolutely. Do you see there any initiative in that moving in a direct? So are there people working on research and development for, not just Hashimoto's, but yeah, I mean, a lot of stuff like the scarier things like multiple sclerosis and even Parkinson's that, if I understand, Parkinson's is, I could be wrong, autoimmune related. I know MS is, there's other nasty things out there that all go back to the the mother of the problem, which is autoimmune conditions. So is there funding and development for that kind of investigation?
I mean, there certainly is some literature emerging. I can't speak as well to some of the other conditions. I'm obviously much more familiar with Hashimoto's, but there certainly is a lot of literature emerging in the Hashimoto's realm of dietary and lifestyle interventions and the benefits or the impacts of those interventions. A lot of this literature is still new. It hasn't really been necessarily replicated. It hasn't made its way into, clinical practice guidelines or mainstream medicine. And, that's really common in the world of food or nutrition or other forms of, natural treatment modalities, is that for one, there's just not the funding to support these types of studies. And for two, these types of studies are very complicated to perform in the same type of clinical trials where we would use for medications, for example, because when it comes to food, nutrition, and other natural modalities, there's just so many confounding factors that can affect the results of these trials. And so it's just incredibly difficult to perform these kind of studies and get results. And so it is tough. And this is a place where, we have people kind of on the one extreme, saying, there's no science to support this, right? And then we have people kind of on the other extreme, saying, everything to do with the pharmaceutical industry is a conspiracy theory, right? Like, we have people on both extremes, and both sides are right and both sides are wrong. But it's just being willing to listen to both sides and seeing, how can we meet in the middle, knowing that we may not have the science or the studies to support some of these things, but can we just work with them as ourselves, as individuals, and see how we feel? Can we draw from, like I was talking about earlier, the ancient wisdoms of traditional healing remedies before we had pharmaceutical drugs, because it's tough, we don't necessarily have the science to support all of this.
And we may not necessarily be looking through the correct lens. I'll keep using that metaphor. And I'm echoing what you're saying with cultures that have taken different and unique approaches to wellness and well-being and prevention and things like that. And so I could point to the elephant in the room and saying that while cultures who are not technologically on the same par as the US and Canada are not dealing with the same self-induced psycho-emotional stress factors that we sort of foist upon ourselves in modernity and with technology and so forth, and all the stress that comes with that, which again, I think is a huge elephant in the room that we could certainly talk about. Cortisol and stress and continuously being in the pressure cooker. That may not, I mean, and I'm not discounting the stress that, say, communal or tribal living is presenting, so the natural world is always going to present, stress factors. There's weather, and as cue the lightning behind me, things like that. So I'm not mitigating. I'm not trying to downplay any of that, but given our hyper exaggerated stress levels that we live with in the West, that seems to be a huge matter. Can we? Yeah, let's just talk about that. Let's talk about things that we can do to pull back from the cliff a little bit of stress and cortisol and all those wonderful things.
Yeah. You raise a really good point because, of course, nutritionist, so far I've been focusing on nutrition, but when it comes to Hashimoto's, there also are a lot of other elements that are as important, if not more important than nutrition, and stress certainly is one of them. Certainly when I was diagnosed with Hashimoto's, I did, everything I could to optimize my diet, but here I was a new mom, and I was incredibly stressed at the time. And I knew that was a huge part of my healing, was to manage and reduce that stress, because, when our bodies are producing cortisol, our bodies aren't producing as much thyroid hormone. When we're, in that high cortisol state where bodies are ready to kind of fight or flight is what it's called. We're not in a mode where we can rest and repair. We really need to be switching into the other branch of our nervous system, which is the parasympathetic state, where we're, resting and relax. So certainly, stress is huge. I really had to focus on how could I get more sleep, focusing on, especially having this newborn baby, how was I going to be able to get more sleep? How could I focus on my own self-care was huge, huge in my healing. And then the other thing that, we should always talk about when it comes to Hashimoto's or any autoimmune disease is the impact of any kind of emotional traumas as well that we've had in our lives, because certainly this can be a huge factor as well. There's many functional medicine doctors who believe that trauma is at the root of almost all autoimmune conditions, because trauma puts our body into this basically like a state of survival mode. And that was another thing for myself that I needed to look at, a major trauma that I had in the past, and how could I work through that? So there's all of these elements, and they're all incredibly important, and it's all kind of assessing which ones are factors for you. And it's not going to be the same exact issues that somebody else with Hashimoto's has. It's kind of teasing out, what are the important issues for you to address in your own healing journey. It's going to look a little bit different for every single one of us, but these are all very important components.
Absolutely. And I might sprinkle on a thought that if you are engaging in any practice to reduce stress, that it's, to me, it's relational in the sense that if, let's say you take up a physical exercise, while doing that, maybe like you said a moment ago, if there was a trauma, if there's a flashpoint in your life, with the help of somebody who can bring you through that, address that too. So I say that, I guess I'll flip the coin over. And so a lot of people will engage in activities that are almost an escape from that kind of getting away from whatever the source was, whether it was years of treachery with somebody that you had to live with, or a flashpoint, like a really sudden trauma event, that there is this checking in with yourself and with somebody who can work with you as a partner, whether that's a therapist or a coach or somebody that can get you started on that. Oh, there you go. Your camera went off for a second. I was getting ready to hit pause. But anyway, not to ramble on too much, but I would say that suggests that, it's a comprehensive kind of checking in and having objective observers, if possible. And that could just be a good friend. You don't have to spend a lot of money on a therapist. But anyway, so I would add that as an amendment for sure, that this is a process that requires a little bit of planning and a little bit of organization and thinking through, to have the greatest efficacy, I would suggest. Anyway, so let's move on to what you're doing now and what you're going to be doing in the future with this understanding from a very personal perspective, and you're having that ability to empathize with what's going on I will have a link to your website down below. What are you doing now, and what are your plans for the future for working with people with Hashimoto's, and also on a broader sense, working with things we were just talking about, physical consumption of food and getting a better headspace and so forth?
Yeah, so I work with people one-on-one to provide nutrition coaching and support for Hashimoto's hypothyroidism, as well as all digestive issues. And we kind of just go through a very individualized program for each person, addressing exactly what their issues are, what their goals are, and how we can get them there. Yeah, and I do that in my role as a holistic nutritionist. And yeah, you can find more about me, like I said, on my website or on social media that I think will be linked here.
Yes.
Yeah, the
Yeah,
notes.
absolutely. And I'll have all relevant links down below. And again, I said this earlier, what I appreciate about what you're doing is you have two perspectives. You have evidence-based medicine and what some people would, and it's almost a derogatory, allopathic, background. And you also have the insights of a more holistic approach, a ground-up approach, comprehensive, however we want to frame that. So I appreciate that you're in that space and that you have that perspective. I think that's valuable for people seeking what is a sincere need to turn their lives around, because I speak with authority, as do you, that this Hashimoto's can be disruptive, and it can be upsetting to not have the faculties about you, whether they're physiological or, as you said, with brain fog, and so both somatic and in the mind as well. So, but yeah,
Yeah.
okay, go ahead.
Yeah, and I just want to add it in the caveat as well, and I think it's been assumed already throughout this discussion that certainly, I'm not against medications by any means. I'm not against the pharmaceutical industry or mainstream medicine, nothing like that. And I think that came through in my messaging. Like,
Yeah.
we're so fortunate, especially, I live in Canada. We're very fortunate in Canada that we have a free healthcare system, and we have access, right, to pharmaceutical medications in the case of, acute illness, infections, and injuries, right? I really am grateful for all of this. It's just, I can also see where the breakdown in all of this is. And it really comes into the management of any kind of chronic or complex disease, especially autoimmune disease, where we can see a lot of breakdown in this medical model, where medications on them in and of themselves are not addressing the whole issue.
Yeah. And again, not to laud too many praises on you, but like I said, there are a lot of people out there doing nutritional counseling or working in a similar vein, and they're sort of asymmetrical in that sense, or they may, like you said, they may even be cynical towards the pharmaceutical industry or Western medicine in general. And I think that, as you said, both right and wrong, there are criticisms that could be leveled, but that has to be done very delicately and by people who can carry that conversation. So again, I appreciate the fact that you have that background, and that so you're not going to lead somebody in a direction that may not be best for them, that you have that sensibility and that grounding there to monitor. Yeah. And I echo what you say. I've benefited tremendously from Western medicine and pharmaceutical interventions through my life. And I would never for a moment poo-poo that. So yeah, absolutely. I think that should be understood. And but yeah, nonetheless, the fact that you can integrate and bring in the holistic is such a perfect word. The ability to work with somebody on a far more comprehensive level, so preventative and future thinking rather than maintenance. Especially like again with Hashi's, that they can just put you on levothyroxine or something like that for indefinitely, and but you can do things now. So I guess, and we're getting close to the time we talked about doing about an hour. But so one question is, if you're bringing a lot of things online as far as reaching a homeostasis or equilibrium health-wise, do you see that the need for the level of either MP thyroid or levothyroxine diminishes through testing? So they'll say your doctor will adjust you down. Have you ever, has that been your case, or do you see that?
Um, so that hasn't been my case.
Okay.
Certainly, I wouldn't say that's outside the realm of possibility.
Okay.
I think it would depend on how much destruction there's already been occurred in your thyroid by the time you're diagnosed and are started on treatment. And I mean, one of the principles of, holistic nutrition is that, we believe that when the body's provided the resources it needs, it does have the power to regenerate and repair. And so, I've heard stories, certainly of people who have been able to come down off of their thyroid medications or reduce their doses. So I'll just leave it at that. It may not be the realm of possibility.
Okay.
But it also likely won't be the case in everybody. Yeah.
Well, sure. Yeah, no, that's understandable. I know I'm at a fairly high, I was doing levothyroxine, and I can't remember the amount, but now I'm on MP thyroid at 115 milligrams. So maybe I'll use myself as a guinea pig and a single case study for that. But that would require me getting on probably a little more honest diet. Like, I love my bread, and I my wife and I try to eat very clean, but there are much more things I guess I could do. So maybe that'll motivate me because anyway, it's just a challenge, and it's an opportunity. But yeah, I agree. That's something that is dependent on each individual, and so let's hope that there are people in the future that can make that happen and live with less dependence, but still nonetheless staying within the bounds of what their physician advises and calls for. Sarah, it's been a beautiful conversation. Do you have a final thought or anything you'd like to add before we say goodbye on this particular conversation? You're always welcome to come back. And we can talk about progress in what's going on with you personally, with your work, but as well insights that might be out there.
Yeah, I guess my only final comment would really be to anybody out there with Hashimoto's is that you don't have to struggle, you don't have to suffer alone. Even if your labs are normal, even if your doctor tells you there's nothing else you can do, there are, a lot of dietary and lifestyle interventions that can be quite helpful. So just wanted to throw that out there.
Absolutely. That's a great way to wrap up what I consider to be an important conversation. And I hope the audience, the YouTube viewers, were able to have some good takeaways. Again, anything we've discussed here is all sort of in theory, and it's not anything that we're either one of us are advocating directly. So do your checking in with your therapist, your physician, whoever it is that's overseeing your health care. Make sure that you're careful in that regard. And that applies to anything you see on the internet. So just be very cautious. It's your health, it's your body. So, Sarah, I very much appreciate this conversation. Do you ever, so one last question out of right field, do you see yourself ever writing a book to sort of help anchor what your personal experience as well as what you're working with in your clients?
Yeah, I've had a calling to do that ever since I finished nutrition school about 7 years ago.
Okay.
There's ideas floating in my head, so we'll see what happens in the future.
Wonderful. Well, if you do publish a book, I'll bring you back and we'll talk about the book, because I love to interview authors. That's probably the majority of what I do is interviews relating to books. So, and and honestly, I've never even looked to see how many Hashimoto's support books are out there. But I think, again, you're having a broader perspective would be a really good opportunity for a book. So, I will see that happening for you. I will see the vision of good writing and that impacting people's lives. And so, but you've got your work cut out for you right now, book or no book. You've got a good mission that you're on. And I support you in that, and I find it inspiring that there are people out there like yourself who are trying to help. Because while there are certainly far more grave illnesses to deal with, Hashi's is as the young ones say, it's no joke. You want to make sure it doesn't rule your life in terms of you not feeling well and being at your best. So thank you for your efforts. Thank you for coming on the show with me and having a conversation. I very much appreciate it.
Yeah, it was great to be here.
All right. I'll say goodbye to you after we stop record, but to the YouTube audience, thank you guys so much for staying with us to the very end. I appreciate that. I appreciate all my subscribers if you're there. Y'all take care.